Once you go home after knee replacement, you need to follow your doctor's instructions in terms of wound care and activity to prevent complications. You will typically have a adhesive waterproof dressing over your knee, and this should stay on at all times. You will be allowed to shower. You will need to try to avoid any trauma, and typically use of the wheeled walker is recommended for that. You'll also need to sign up and follow through with going to outpatient physical therapy, which is critically important after knee replacement.
I usually recommend that my patients avoid running and jumping type activities after knee replacement surgery. Other than that, they can pretty much do what they feel comfortable doing. The majority of adult activities of daily living and adult lifestyle is very much conducive to a knee replacement.
If you suspect you're having a complication after your knee replacement surgery, you should get in touch with your surgeon or your surgeon's office. If he's not available, someone from his office, either an associate or a physician's assistant, should be able to talk to you or return your call, and then they can assess whether you need to make a visit to the office or possibly even the hospital, or it may even be something that should be just handled over the phone.
Activities after surgery that should be avoided after knee replacement would be kneeling. It is not advisable to kneel as your wound is in the front of the knee. You should follow your physical therapist's instructions in terms of the exercises you should do. And when you sleep, you should have a pillow under your calf or even under the ankle to try to keep the knee straight. It is not advisable to have a pillow underneath your knee because that will cause flexion contracture of your knee, meaning that you will not be able to straighten it all the way, even after recovery is completed. Activities after surgery for knee replacement that are recommended include exercises, particularly range of motion. Patients typically will have upwards of 6 weeks to regain or gain more range of motion than they had before. After 6 weeks, typically the progress is very slow to non-existent.
Following knee surgery, it may be difficult to bend your knee initially, so it may be difficult to reach fully down to your foot, your lower leg. So there are some reaching devices to help you with tasks such as lower body bathing and lower body dressing. Those devices are a reacher, which is used to help you start your pants over your feet. It can also be used to hold a shoe in place while you slip it on, or it can be used to retrieve items from the floor if you're unable to bend down and pick them up. The second device is a sock aid, which is used to put your socks on. And that typically is a task that's difficult in those initial days after knee surgery, reaching fully to that foot to start your sock. Another device is a long-handled shoe horn. It's used just to help you slip on your shoes. And if you have difficulty putting your shoes on before surgery, it may be needed following. And lastly, a long-handled bath sponge. It's just a sponge on a long handle that allows you to fully reach down to your foot and lower leg if reaching down there is difficult. Some larger equipment that may be needed after knee surgery is a riser for your toilet. It may be difficult in those first days to get down onto a standard height toilet, so a riser might be beneficial to make it easier to get up and down. Another device that you may or may not need is a shower seat, and we do talk to you about that on a one-to-one basis when you come into the hospital. The need for the shower seat is really based on your bathroom setup and how well you're moving after surgery.
Driving after surgery for knee replacement is a tricky question. It involves which side is being done.
Typically, if they're a right-legged driver, and it's their right knee or right hip, it's about a month before they're ready to drive. If they have their left knee replaced and they're a right-legged driver, then they may be able to drive as soon as a week or two after the surgery, again, depending on the necessity of narcotic painkillers and the ability to react and not worry about protecting their new joint.
After knee replacement surgery, you don't have any restrictions in your mobility with the knee. So getting in the car is not that difficult. You want to square yourself to the seat of the car, sit down, and then swing your legs in. You may need to have a family member help you with your leg if you're having a little trouble. After your surgery, in order to go up and down the stairs, you have to remember up with the good, down with the bad. So when you get to the bottom of the stairs, you want to go up with your good leg or your non-operated leg, and you want to go down with the bad or your operated leg. After surgery, you will continue the exercises that you have been doing in the hospital, but you can also increase the number of repetitions or the frequency of the exercises to improve your strength.
I generally tell patients that the recovery time is 3 months. However, you should expect your knee to improve in both comfort and function for a full year. Improvement over that first 3 months is the most dramatic. That's when you go from using your walker to walking independently to going up and down stairs 1 foot after another. Generally by 3 months, you're walking without a cane or a walker. You're going up and down stairs every other foot, getting in and out of your car. You're usually comfortable enough to return to work. Very often you're comfortable enough to play golf or go bowling. So 3 months is a pretty safe period to be fairly fully recovered from your knee surgery.
If a patient was unable to get to an independent level with their mobility in the hospital, a short-term rehab stay may be indicated, and as the team, we work together in order to get you there.
A patient will be sent to short stay rehab, usually the 3rd day after surgery. In the morning, they will have their breakfast, their vital signs, some blood work. We'll do discharge paperwork. We'll have a physical therapist see the patient, and oftentimes the rehab facilities like them early. So we do try to aim for them getting out around 11 a.m.
The benefits of using a walker is to assist with your mobility. Most patients have some muscle weakness after surgery. They also sometimes have problems putting pressure on their affected side. Most of the time you start out using a walker, you step with your operated leg, followed by your non-operated leg. And we will go over this while you are in the hospital.
After knee replacement surgery, typically we see patients about 2 weeks after the surgery to remove their staples, their stitches, to take an x-ray to make sure they're coming along and making good progress. We make further recommendations to them at that point, and then usually we'll see them at least a couple more times in the next couple of months. So usually 2 to 3 visits in the first 3 months. Then we usually like to see patients a year after their surgery and every couple of years after that to make sure that they're still doing well and that they're not having a problem with the prosthesis that they don't realize.
Even if your knee is feeling fine, to have a checkup from your physician, have x-rays taken to evaluate for any early loosening or wear. Small problems can often be corrected with small surgeries, whereas if it becomes a big problem, then it usually requires a much bigger surgery.